Amos, are you recording?
Yes, I'm recording. I started recording.
Go to the social media page.
I am connecting to Facebook now.
Okay. Oh, Onesimus, please make me co-host and Salome as well so that we can start.
Yeah.
Hello, welcome to today's webinar. Hear me, please give me a thumbs up. Box, yes. Going to get started. Also expect more people to join us. So my name is Vincent, and I am one of the founders of Wright Associates and your host for today's webinar. So is going to center around becoming a health researcher. And we're really excited speaker going to be joining us all about what it's to be an of global health. Just give me a minute. I just want to is able to connect and we will be right. Thank you. Please tell them we're getting started because this is just going to an hour. We want to respect your time. So out of here very soon. All right. In the meantime, while we wait for Berin to join us shortly, if you can let us know where you're tuned in from, we would love to know. For those of you in Nigeria, tell us your state. For those of you outside Nigeria, please tell us what country you're tuned in from, because I know we have people from outside Nigeria. Once again, I'm Onyinye Ede Vincent. Thank you for joining us. And today we're going to be talking about how to become a global health researcher. I am going to introduce our speaker while she makes her way online. So give me a few minutes while I wait for you to also type into the chat box where you're tuned in from. All right. Chinedu for the win. Thank you. Chinedu is tuned in from Ogun State. Okay, I see Queen from Lagos. I see Abuja in the house. All right, all right. Jos, wow, wow, I'm loving it. I'm loving it. All right, Taraba is here. Okay, Anambra in the house, Rivers State. All right, all right. Okay. Thank you all for joining. Thank you for joining. Keep the chat coming. We also want to know, what are you looking forward to in today's session? What are you most looking forward to? Maybe you want to make a new friend. Maybe you want to, I don't know, get somebody's contact information, become a better researcher, or you're not even sure. You just thought this sounds cool, so you just joined us. What are you looking to gain from today's webinar? Okay. All right, I see our speaker is in the house. So I'm going to go ahead and introduce Dr. Berin Odeni. So allow me to stop sharing my screen so you can see my face and also see her face. Dr. Odeni, please, are you able to turn on your video so we can see your lovely face as I introduce you? Awesome, awesome. Welcome. We're going to spotlight you for everybody. So everybody, this is Dr. Berin Odeni. She's a medical doctor and she's a global health practitioner, also an academic editor at PLOS Global Health Journal. Dr. Odeni has a PhD in dissemination and implementation science from the University of Washington. As a global health leader, she has a track record of successful global multisectoral collaborations with scientists, clinicians, program managers, patient groups, and funding agencies, among other stakeholders. She is currently an assistant professor of surgery at Washington University in St. Louis in the United States. Her key interest is in the promotion of population health through communication of evidence on high-quality health interventions. As a dissemination and implementation scientist, Dr. Berin seeks to optimize publication systems to ensure rapid communications of scientific breakthroughs. Her mission is to advance global health through equitable publication processes, open science practices, and dissemination of evidence on translational science and implementation practice. Oh my goodness, I said a lot of big scientific words, but I hope she's gonna break it down for us. But just on a personal note, Dr. Berin is a friend and a mentor. She's a superwoman, a mother of 3 amazing boys. And I know we're going to have a fantastic time with her today. So get your pens and your notepads ready, get your questions ready. As she speaks, if any questions come to your mind, please feel free to use the chat box and send us your questions. She's going to have a few minutes to take questions at the end of her presentation. Welcome, Dr. Odeni. Please give her a round of applause, and the floor is yours.
Yes, thank you, everyone. Thank you, Onyinye, for your very kind introduction, that very lengthy introduction. I feel that it has changed over the years since I moved from being an academic editor to my additional role as an assistant professor. So that has changed a bit, but still my mission remains to, ensure that there's population health equity. So thank you so much for that introduction. I see I have only 20 minutes, but I'll just try to make it short and maybe just put more time for your questions if you have any. So global health, I think I was given the task of talking about the significance of global health. Of course, we have to start with the definition of global health, and there's so many definitions out there, and it's still a word or a term that many people are grappling with as they see the results of what has been in the past called global health. So originally, some of the common definitions of global health, which I think are simple to understand, is that it's an area of study or research and practice that places a priority on promoting the health of people around the globe, that's everywhere, and in so doing have equity in health of everyone. So to promote the health of every individual in the planet in an equitable way. So when you look at what's happening around the globe, there's been many questions about, is global health achieving what it's supposed to achieve, as we continue to see the inequities, as we see what COVID-19 did, the distribution of vaccines. Some other definitions of global health go on to talk about the transnational borders that the field of practice it requires. So you see, you have health issues and health problems, concerns that transcend national borders. There are really no boundaries or borders when it comes to global health, when it comes to disease, when it comes to poverty, when it comes to climate change. And these are circumstances that have influenced countries and people to come together to collaborate to find, common solutions or solutions that can be implemented in different places that have worked in other places, or even to have, reciprocal innovation where you have something that's being done in one country, being done, especially in a low and middle income country, being done in a high income country, as you have seen for fields like HIV. And so basically, I think the key elements of global health are that it's transnational, it deals with improving the health of people everywhere. And when you talk about global health, you cannot say any field is off the table, is off the reach. All fields feed somewhere into global health, be it engineering, be it social sciences, be it law, be it sanitation, whatever you have. There's so many fields. I mean, history, economics, big thing. Policy making is important when you think about environmental sciences. So almost any field, you could almost say any profession in the world can go into global health and they will not be lost. They will have a space to play. There's a seat at the table for everyone, even if you talk about security, military. So I love the University of Washington, where I did my training, where we had so many different, small classes, like, let's say, global health and security, global health and war, global health and mental health. So it shows you how not only transnational is global health, but also transdisciplinary. So you cannot say that I am into business and marketing and I don't care about global health. I mean, COVID-19 showed us that you have to care about global health. So it is a worthy topic, and it's a field that is worth delving into and even investing your time and resources in. Some of the global issues that you have maybe listened to or heard about, you've heard about climate change, you've heard about the food crisis, the insecurities, the emerging threats like diseases and pandemics that are now spreading around the globe. You hear about poverty, you hear about issues to do with non-communicable diseases. Non-communicable diseases such mainly caused by tobacco or poor diet, and these big food companies that really drive people's nutrition, and that is detrimental to individuals' health. So there's so many fields and there's so many global health issues that you can get your feet dirty and just kind of going through the waters of what global health is. So there's a significance for global health. In the past, global health, it has morphed from so many definitions. Initially, we had public health that was mainly focused on disease, epidemiology, and basically controlling diseases, preventing diseases. A lot of focus was on prevention of diseases. And then, we came into international health, which mainly looked at people, from the high income countries going to do work in low and middle income countries, kind of coming to help those people who had no idea about what health was, no idea about what immunization was, how to manage malnutrition. Tropical diseases were a huge thing. And now global health is more recent in the sense that it came after all this, but it carries so many roots from back then. And again, there are so many issues with global health. We're looking at the roots of global health are really entrenched in things to do with colonialism. So we find that some of the mindsets of the past are being still forwarded into the mindset of today, and we are dealing with who is really at the seat of who's really driving the agenda for global health. So as emerging global health leaders, we need to be thinking about what is crucial for our continent, not just what is crucial for those who are funding global health, because that for a long time has made, low and middle income countries, Africa, Asia, to lag behind in their own progress because they're trying to meet the goals and the targets of the funders. So it's really, the onus is on us as people who are engaged in global health to really stand up and say what is important for your nation, for your community, for yourself. One of the key challenges I would like to place to global health practitioners or anyone who wants to get into global health, make global health practical. I know there's a lot of research. Global health involves research, it involves practice, it involves study, but let it be practical. So we have so many discoveries, so many new things, so many drugs coming out in the field, but are those translating to get to everyone so that the health of everyone in the world is promoted? Those are some of the things we're dealing with. I recently wrote a paper looking at, redefining global health. Is it really the term that, is it that global health needs to be redefined, or is it that our perspectives and our scope needs to change? Because we need to be focusing on sustainability. For a long time, global health has just been somebody from America coming to Nigeria to run a HIV program, and they will go back and say it's global health. But America itself has so many challenges. There's the war on drugs, there's the mental health crisis, there's the gun violence. I mean, somebody from Nigeria can go to America and even advise people, and that kind of reciprocal innovation and learning from different people around the globe. So I think one thing about global health is know what's practical, what matters to your context, and advocate for that. And the next thing, learn from people. It's not just that the people who have money have the solutions. Even those who don't have the money have the solutions. And many of the solutions that we can get or develop do not need funding. They do not need you to have tons of money. You can actually find your own solutions in your own spaces if people just come together and not, separate themselves and be in a competitive type of atmosphere. So I hope that kind of gives us an overview, and I'm happy to take any questions now because I see I have 12 minutes. I don't know if Onyinye, that wraps it up in a nutshell.
Awesome. Thank you so much, Berin. Over to you, Salome, to take us through the question and answers.
Okay. Good afternoon, everyone. And my name is Salome. So I will be going through some of the questions that our participants had dropped earlier on for Dr. Beryl to take to answer some of those questions before we go properly into the discussion aspect. So one of the questions is, what are the processes in becoming a global health researcher? That's one of the questions, yeah.
Well, when I think about my story, it started off with me seeing the problem. So I saw the problem, and I was working in a public health facility, and I could see that there was a huge need for supplies, the supply chain, provision of essential materials, even for conducting simple procedures like a delivery were lacking. You would have to trek from one department to another to get, just simple things like tools for wrapping someone's wounds. And so that made me feel that the system was broken. And I decided to extract myself from the system and get to learn more about public health as opposed to be a clinician. I thought that it would make more sense for me in my mission in life to have a wider or a broader impact in the community and for the populations I was serving, as opposed to having, that very clinical one-to-one relationship with people, which is important still. There are people who are meant for that. That's what they're built for. But I felt that I needed to really get a higher level, a higher bird's eye view of the problem and see how to address it. So I think some of the steps from my journey to becoming a global health researcher include having that strong educational foundation in relevant fields. It could be like medicine, it could be nursing, it could be public health. You don't necessarily need to be clinical, but have like some of that public health experience and know, some of the norms around health and what your community is lacking. So as you begin to understand the geographical differences in different types of health problems. You could be in one part of the country versus another part of the country. You see the needs arising, you see the challenges, and that helps you to think meaningfully about the research that can contribute. So I think one of the processes is really identifying where the gap is and where you can contribute. You don't want to just go into global health and say, well, I want to solve everything, or I'll just figure it out. Some people do figure it out along the way, but really it has to be centered on something that you want to achieve within the health ecosystem. So you need to get your basic training and foundational training in things like epidemiology, biostatistics, research design. These are a crucial foundation for doing work that's measurable, sustainable, and transferable. And transferable, I mean that, you don't want just your innovation to just stay in that one facility, but you hope that whatever you discover, your research, your discoveries, your innovations can be, practiced and disseminated to other places in the world, or in similar settings across the world, or even to places around the world that seem to have the money. So a lot of things can be done, like mobile health, things that were done in Africa already now being implemented in the United States and other high-income countries. So the goal is really to find your foundational training, and that's why people do their masters in public health, and they get that foundational training that helps them to set themselves up, for that advocacy and the work that needs to be done. So you could have a voice, you could be an advocate, but if you don't have the training, you don't have the power to leverage, the funding or the resources you need to conduct the work that can change the population health. I hope that makes sense. And I think the fundamentals in global health, the fundamentals in research course that you want to do is one that people can really take and enjoy the benefits of that kind of brief overview that introduces you to global health and research.
Okay. Another question I would like to ask is, the participant asks, what are the opportunities in global health? What are there the career opportunities for those that are coming from other backgrounds to be trained in fundamentals of global health? Are there opportunities out there for them that they can explore?
Oh, absolutely. I think I touched on this as I was talking, so I will not go much into it, but I'm telling you, there is every single opportunity available to anyone from any discipline. I mean, even if you're a pilot, you can still find a place in global health. And there's so much that you can connect with global health, be it immigration, be it law enforcement. So all you need to do is figure out where is the problem. And you'll find that that problem is most likely not just constrained to that one area that you are experienced or exposed to. You'll find that it's also something that is affecting other parts of the world. And you will be surprised what people have done, research people have done. I've seen good research talking about road accidents and how to prevent road accidents. It's a thing that that is needed around the globe. I recently talked to a pharmacist who was shocked to realize that pharmacy had a really big role in global health, especially with the rise of antimicrobial resistance and antibiotic stewardship. So you can find, I don't know, you could almost like throw anything in there and you'll find a place for it in global health, because it's the health of the planet and everything is interconnected, interrelated. I hope that answers your question. So there's a lot of opportunity to be a researcher or practitioner of global health.
Okay. Thank you very much, Dr. Berry. So because of the time constraints, I'm just going to ask you a few questions. Then you can just, I would like to know, just share with us briefly your career path in global health research. What are those things that spurred you to go into global health research? What are those things that, just share that your journey into the global health research with us. Thank you very much.
Yeah. Oh, wow. That's, I hope I have 6 minutes, so let me try. Now, my journey, as I said, started as a clinician, seeing the despondent health system and trying to extract myself. So I was actually focused on public health. That was my initial mission. So I was just thinking, this is public health. We need to go and fix our health systems, work with the Ministry of Health, see how to improve the services we're offering. And so in the process of that, I got my admission to do my master's in public health at the University of Washington. And so I left the country where I was working in, that was Kenya, and I went to do the Masters in Global Health. And there are different tracks that we could choose. I think those are Masters in Global Health, Epidemiology, Masters in Global Health, Biostatistics. There's Masters in Public Health, Epidemiology, Masters in Public Health, Biostatistics. So there are different tracks in it. So the Masters in Public Health, Global Health. So I'm like, this is interesting. What is global health? So I went in, and that was kind of one of my first lessons was problems in global health. And, a lot of the problems when I was taking this class were focused on low and middle income countries, focused on Africa, focused on Asia, focused on the inequity in funding and how the funding from, the high income countries, it really leaves the low and middle income countries more deprived than they were initially, or less, their hands are tied. They can't really act freely and do freely what they feel is needed for their country. So I began saying, okay, we have so many problems in low and middle income countries. And so my pathway into research when I was doing my work as a research assistant was really on, HIV programs, HIV research. And this was looking at prevention of mother-to-child transmission of HIV, adolescent HIV, HIV in children. And then I went into electronic medical record systems and the impact of electronic medical record systems in improving the outcomes of patients' healthcare. And so that was my kind of practice at the time. I worked with quite a number of institutions around the globe, worked with the NIH, I worked with CDC, I worked with the Bill and Melinda Gates Foundation, and I noticed unilateral, that the transfer was mainly unilateral, not bilateral. Everything was coming from where we were going to the low and middle income countries. So that was kind of my sense of, oh, this is global health, this is global health. And only until I started my work as an editor for a global health journal did I see that, there are people who are trying to solve problems in Africa, but there are also people trying to solve problems in the United States, trying to solve problems in Europe, trying to solve problems in Australia. And that made me realize it should be actually bi-directional. And of course, I began to engage with a lot of work of people who have not only done stuff in Africa, but they're also trying to transfer it back to the high and middle income, the high income countries. And so that kind of started changing my mindset. And then with the rise of the whole talk about equity, what is equity? What is global health equity? I began to see gaps in the system, which many people are seeing. I mean, when COVID-19 came, who's getting the vaccines? Who has the resources to give the vaccines? And right now, I am actually working in St. Louis, and I'm helping with the cancer control programs and cancer control research. And we're using some of our learnings from HIV control in Africa, strategies in cancer control here. So I feel that in that way, it's like a full circle kind of thing that you can transfer your knowledge from one side to the other side and benefit. And of course, being in this system in a high income country, you can see that there are lots of challenges. There are so many gaps. I mean, the things that we thought were already solved here are still unsolved. So we need to look at global health more holistically and say, who in the globe is needing help? We all need help. And within even high income countries, there are low income spots that need help. So I think that's been my journey. And I hope that kind of sums it up for you and makes sense to everyone. Yeah.
Thank you so much, Dr. Berin, for your time. It has been a very engaging session. There are a lot of questions which we cannot take due to the time constraint, but we are always ready to have you speak to us. Because it's really an eye-opening one, knowing that anybody can go into global health as long as the person defines a problem and knows where and how he can fill in the gap in ensuring that that problem is solved. Absolutely. So it's one key take home today, knowing that anyone can be part of global health research. All we have to do is contribute to the general problem solving globally. Thank you so much for your time, Dr. Berin.
You're going to email me, and I'll be able to just send back my responses, and you can redistribute so that no one is left or has unanswered questions. Thank you so much.
Yes.
Thank you. Thank you very much.
more conversations with Berin, join the Global Health. You're going to be one of our mentors. So that's another plug for the course. Thank you so much, Berin. We know you have to run.
Okay.
Talk to you. Oh, Salome, are we doing the panel discussion now?
Yes, we are. We are. Yes,
All
we
right.
are. So, thank you for that. So we are going right into the panel webinar, this meeting. And briefly, I'm just going to introduce you. You have introduced Dr. Berry. So I will just quickly introduce you and ask you some questions. We have about 3 panelists that I'll be asking some questions this evening, but we are going to start with you, Oni. So briefly, let me just speak a bit about you. It's quite a lot, you know. You are a sexual and reproductive health specialist and a researcher for over a decade with experiences in national and international health work experience. You have accomplished a lot in the life of a girl child. You have done a lot of family planning. So I want to tell you, I want you to walk us through your journey into this global health research. Share with us your insights on the career path, your journey into global health. We would like to know. Thank you very much.
All right, awesome. Thank you so much, Salome. Okay, I'll try to keep this within 5 minutes or less. So I am Oninia De Vincent, of course, and I've been working in the field of global health, specifically adolescent sexual and reproductive health for the past decade. And my introduction into global health I think it started when I was a teenager, even though I didn't know the term global health at that time. As Dr. Berin mentioned, the first way to get into global health is really identifying a problem. So as a teenager, so I grew up in Lagos. Well, I left when I was 13 and I lived abroad since then. But as a teenager in Lagos and in the US, in Atlanta, I had a lot of friends who were pregnant as teenagers. I also had a lot of friends who were engaged in sexual activities, and young people were increasingly being infected with HIV. So for me, I just kept wondering pregnancies and why also are we the fastest population when it comes to HIV. So it was just realizing that problem and wanting to do something about it that really started my journey into global health. So I kept that in mind. University, initially I wanted to become a doctor because I was very impressed by medicine and what doctors do, their ability to save lives. But I was in college, so I went into college with the idea of studying biochemistry. But then I took a course in sociology, and I also took a course in African history. And I just started learning a lot about history, also learning about how our environments affect our health outcomes. Yes, if you don't know, the environment you grow up in or what you're exposed to really impacts your health outcomes. When you think of people that are more prone to diabetes, or even people that are more prone to HIV infections, or people that are more prone to teenage pregnancies, what kind of environment do they live in? What kinds of resources do they have available to them? So as I took courses that just kept reminding me that really health is about the environment you grow up in, I started getting curious about, okay, how do I get involved in ensuring that people have conducive environments in order to get optimal health? And so I decided that medical school was not really the thing for me. And besides, I really don't like blood. I can't really stitch somebody up. So I gave up the desire to go to medical school. And then I started discovering public health because I would attend some workshops and seminars. People would tell me they are public health experts. And what I loved about it was that a lot of the speakers would tell me that, oh, I just came back from Kenya. I just came back from Brazil. I just came back from this country where I was helping with polio eradication, or I was working on HIV. I was working on a research study. So I was just very curious about, oh, they get to travel and they're actually doing real work that is impacting people's lives. But then I'm like, in all of this, who is actually working with young people? Because for me, I still had that idea, that issue in my mind of young people getting pregnant, young people getting infected with HIV. So when I discovered that at least public health is a field that addresses health problems before they become a problem. So public health is different from medicine in the sense that it focuses on prevention. So that's how I just started learning more about it. And then I decided that within public health, I want to focus on the health of young people. So I ended up actually majoring in sociology and anthropology. Funny story. Well, it's not so funny, but I studied sociology and anthropology because I really wanted to understand cultures and people and how that impacts people's health decisions and health choices. So I got my first degree in sociology and anthropology, but I minored in public health. And then I decided to go to graduate school and focus on global health because I wanted to get a broad view of all that I can do in the field of public health. And then I narrowed it down to the health of young people and women and girls. I have like less than 2 minutes left. But yeah, so that's how I got into global health, a focus on specifically on young people. So that's adolescents. And then also during my grad school degree, I also learned about maternal mortality issues. So I began to do some work around women's health and also women's empowerment, because women's empowerment also contributes to global health progress, because really a lot of the health issues that women are dealing with is because a lot of women are not empowered. So anyway, that's a bit of my story. Happy to share more later, but thank you for the opportunity to share my journey. Over to you.
Okay, quickly, I would just like to ask, in course of your journey, what are some of the challenges that you faced in course of your journey into where you are today?
Yes, I would say finding is it finding opportunity or securing opportunities? A lot of so I got into global health by volunteering. So and I know and I believe this is what you're going to hear a lot of global health experts tell you. You don't just get your first job and you become a global health expert. You have to get your foot in the door. So I think the challenge was securing a spot. I applied for a fellowship. It fell through. And then I just kept reaching out to the organization. I said, okay, I know I didn't get this fellowship, but can you just make something happen for me? I really want to come and learn about adolescent health. So yeah, so you have to be persistent. You also global health, because that is what is going to an organization if they actually can impact the lives of young people. This wouldn't been a challenge, but I know a lot of young people find it hard to network properly within the global health space. Okay, thank you.
Thank you for time. So quickly, we are so I'm going to, I don't know if it's on the call or Dr. Vincent.
Yes, I am.
That will be one of our panelists for today. Chukano, are you on the call?
Yes, I am.
Okay, thank you very much. So briefly, I'm just going to introduce Chukano, a doctorate degree holder in VIEW. He has done a lot of work on policy development, and I want to ask, because we don't have time, what is the drive, what inspired to delving into this global health research in few minutes? Can you just tell us what is that thing that said your passion, your interest in global health research?
All right, in a few minutes, I will say, like Oji mentioned, my career within the nonprofit and global health space started with volunteering. From university days, I volunteered for SAIF, Students in Free Enterprise, which is currently known as an Enactus. And let's move to after graduation and youth service. I had an opportunity of working with an NGO in Rivers State, Port Harcourt, and one of the research we conducted, we're having a comprehensive sexual education for secondary school girls. I realized that a lot of them didn't have the right knowledge about the right use of their body. we equally conducted another research outside, and we realized that there was a high volume of teenage pregnancy, particularly among people living in slum communities, Bunduama to be precise, in Port Harcourt. So that also pushed my drive, and I also worked with Bayelsa State government in curbing maternal and neonatal mortality, being specific to routine immunization, family planning, preventive mother-to-child transmission. So working within that space, you realize that people are going through a lot medically that they don't even have the right information about. The information they have are wrong information. And is in the process of your work that you get to correct those bias. Some people that believe that routine immunization is government's way of killing their children is when you work within that space that you correct it. You realize that the high neonatal mortality we have is a result of parents having wrong information and not bringing out their children to get the right medication. So people die, or people get to the extent of not getting to the right attention they need because someone that should have the right information is not doing the right thing. All right, going further, my work within the public health space has all equally moved me towards looking at cancer research with another colleague who also works, a public health specialist who is doing his PhD, I think, in Australia. We're working on a research that has to do with cervical cancer. For one, I have a background in political science. My doctoral program is also in political science, but I'm looking at cancer research, particularly cervical cancer. So my drive particularly is research and bring the right information to them. They will be making the wrong decision, which will result in loss of life. And if you don't have interest in working within the space, it will equally not, because then we're doing house to house, we're integrating healthcare services and going for house to house, both routine immunization and family planning and several other packages. So when you find out that some people are unwilling to come to you and you're unable to take those services to them, it brings about loss of life. And the interest is to curb both maternal and neonatal mortality. So my experience, or my drive in a nutshell, has been towards curbing unwarranted deaths or stunted growth in children. Maybe some people will talk about exclusive breastfeeding. Some people will also tell you, oh, that they, for one reason or the other, they don't want to breastfeed their children for a long time because it might make them prefer liquid over food. Those are what's the for I don't know the right word to use at this point, but those are false. If you talk about breastfeeding and nutrition, which is also a part of public health, there are several certain things you need to give a child. There's a particular weight a child should have over time before you start talking about the child having stunted growth, being wasted. And for a child that has stunted growth, there are still remedies. But with people that don't have the right information, you will see a child that is malnourished having several other health complications because the parents don't have the right information. So one of my drives is the right information, which will come through research and also working within the space and bringing the necessary services to people that require them. I don't know if I've answered your question correctly.
Oh, okay. Thank you very much, Chukwano, for that. It all boils down to identifying a problem and seeking
solving it.
ways to provide solution to that problem. Thank you so much for your time. We are Dr. Vincent. I don't know if he's on the call. He's our next panelist that will just be giving us a few insights about his career journey, some of the challenges he faced and the opportunities in it. He has a lot of experience in clinical medicine, public health, maternal and child health, adolescent health, and academic research. He's Dr. Vincent Emmanuel. Please, Dr. Vincent, if you are there, please say hello. Okay, so Dr. Vincent is presently not available. So quickly, because of the time left, I'm just going to do a recap of what our speaker, Dr. Berin, has said. Our panelists, Onyinye Ede and Chukwano Okoli, had mentioned. In summary, we see that first, global research is transnational and it's also transdisciplinational. So we have to understand that there is a problem. Once we identify that there is a problem, it doesn't put into any account of your discipline. As long as you can identify that there is a problem and you have that interest, you have that passion to proffer solution, then yes, this global health research, this space is for you. Another thing you have to take into note is that you need to understand that the epidemiology aspect, you need to understand the biostatistic aspect, and you also have to understand the research methodologies. All this can help you. They are all pivotal in you carrying out a research that could affect the community you are trying to proffer solution. It helps you, it guides you on the right steps to take. So it's also very important that you have this knowledge, this background knowledge, and it will help you to go far. Not forgetting that it's not going to be a smooth ride. There are a lot of challenges you will face, like Oni has mentioned. It took her time, it took her persistence, because she knows what she wants to achieve. She kept pushing. So you should know that when you are coming into this global health space, research space, it means that you have to be persistent. You have to be conscious. You have to be deliberate about what you want to do. Those are one of the key takeaways I think everyone should take today home, and know that this is something we can do. It is not meant for only the doctors. It's not meant for only the pharmacists. Together, we can make our country, our little environment, our community a better place. It all boils down to identifying the problem. So in few minutes, I'm going to ask one of the panelists to also speak about our upcoming opportunities. So over to you, Chukwano. Hello, Chukwano, are you there?
Okay, it seems we have lost Chooks.
Okay.
So okay, is Bright on? I don't know if Bright wants to say something, or otherwise I can go ahead and just talk about the opportunity through the Global Health Research course. Is that okay, Salome?
It's okay. It's okay.
All right. Okay, I'm going to want to be able to discuss you enroll in this course. And this course for it's going to be a facility at our 4 sites. We're also offering it at a discounted price, because if you were assigning an individual, you would have to pay about $200, which approximates to about 200 and something thousand naira. But with our site, we're giving it to you at a discount, and you only get to pay 45,000 naira. You heard me correctly. Yes, because we love you all. We really want you to build your research skills, and we want to see more of you going global like Dr. Berin. So I'm fundamentals of going to try to share. This will work. Okay. Let me try to see. But also we're going to drop the link so where you can learn a course that will build your skills as a researcher. So we will teach you how to actually conduct public health research. And then also how to secure funding for public health. Okay, so just give me a quick second while I try to share my screen. Sorry, all. Okay. So the course actually starts in April, but we need you to register by February 20th, because that's when the discount applies. On up until February 20th, you get to have it at a discount of 45,000, and then applications actually close after February 20th. It doesn't seem like my screen share worked, so I'm just going to read the course offerings, and then you all will get a chance to go on the website yourself and read more about it. Oh, perfect.
For you, can you see?
Thank you. That's why we have an IT expert in the group. Okay, yes. So it's called The Fundamental of Global Health Research, and over the course of 3 months, you're going to have, we have 10 modules. The first module will talk about study design. How do you create a research study design, focusing on qualitative research? Then identify collaborators. How do you identify mentors to support you in your research? And then we'll go on to talk about grants. How is successful grants? Because that's not just about writing for grant opportunities, it's about writing a successful grant application. And then how apply for funding. So we're going to show you opportunities to access funding. I think somebody asked the question about funding. And then also we'll tell you why funding is actually important. So that's the significance of funding, and how to also be innovative as you're seeking funding opportunities. Then we'll also talk about how to approach your research. Once you have a problem you want to study, how do you decide how many people do I need to talk to? What kind of research do I need to conduct? What is the scope, and what ethical requirements might I need? And then also we'll cover budgeting. So basically every aspect of funding, we will cover it for you. We'll teach you how to create a budget, how to get bio sketches, which are like profiles of your team, and how to also do peer review, how to have somebody review your grant proposal. We'll also talk about, of course, I mentioned ethics in research, because it's very important in global health. Whenever you're doing research, consider the ethical implications when you're working with human beings, when you're working on document articles. So we'll talk about plagiarism, how to make sure that the content is your own original work. And then, of course, we'll talk about data, because research, you can't do research without collecting data. So how do you manage your data? How do you analyze your data? And then how do you design the instruments that you will use to collect your data? You all might be familiar with interviews, surveys, focus group discussions. So there are so many other research instruments that you can use, even apps that you can use to collect data. And then lastly, disseminating your research. One of the things we found in Africa is that a lot of people are doing research, but they're not sharing the findings. And that's why we don't see a lot of innovation in medicine, or in even interventions. We don't see a lot of innovation because people are not sharing the results of the research that they've done. So this course is actually going to teach you how to write your research findings up, and how to submit it for and even for many people want to travel and present at conferences. So this course will also teach you how to do all of those things. I mean, if you're like me, some of the things I said got you very excited. So if you're really excited about anything I said, can I see you put an emoji in the chat box? Either a thumbs up or confetti, or you can say yes, or yeah, whatever you want to do, but excited as me. As I said earlier, this is an opportunity. We really want to help Nigerians and Africans really to build their research skills. Because like Berin said, when she got to the US, she realized that whereas they are sending Americans to Kenya or Nigeria to come and work on HIV, there are also issues in the US that need intervention. As somebody that lives in the US, I can tell you things like teenage pregnancy are real issues in the US. Things like HIV, even though we know Africa has the largest burden, but there are still people getting infected and living with HIV in the US. Even COVID, we saw how COVID impacted all countries of the world. So there are so many opportunities for Africans to really penetrate the global health research field, and we're here to help you. All right, that's a wrap from me. over to Bright or whoever is doing our conclusion.
Okay, thank you very much, Oni. Chizulum will be taking the closing remark and also proceed from there. So Chizulum, over to you.
All right, good evening, everybody. I'm so happy to be with you. I hope we all learned one or two things, and I hope we all going to grab these opportunities that we have here. So this is me saying thank you, all of you, for being here, for taking out your time to be part of us. You can follow Right Associates on all social media handles. We are live on Facebook, Instagram, and Twitter. So also on LinkedIn. So you can join, just search for Right Associates. Then you can learn more about the course, the fundamentals of global health research course on our Right Associates website. Hope we can drop the link on the site, on the chat box. So everyone, thank you so much. I would love to meet, proceed from here, and I would love to meet each and every one of you, get to know each other and get to know our field of study. So over to Salome to take us on that. Thank you very much.
Okay. Thank you very much, Chizulum. So in just a few minutes, we'll just need one or two people to raise their hands and introduce themselves and maybe tell us their areas of interest, what they look forward to, and we'll wrap up in less than 5 minutes.
Hello. Yeah, I want to. I can't say my hands raising. My name is Dr. Leke. I don't know if I'm being heard. Please, anyone?
We can hear
We
you.
can hear you.
Yes, my name is Dr. Leke. I'm actually interested in public health. I got to know more about public health while doing my PhD program. I worked on environmental toxicology, so it was out of a personal experience living in a polluted area in River State, polluted by polycyclic aromatic hydrocarbons, and I noticed that it's actually a public health concern. And I think it's because of my research, it's part of a public health interest. And as I delved deeper into the results of public health skills in my research, so that's how my interest in public health emanated. So I went for a deeper, in-depth study about biostatistics and epidemiology. So I don't know how this group will be able to I don't know, knowing the situations around us in Nigeria and every other thing, I think it can be of help. Actually, the group we know here, and we should be of making us to be part of this research. It's something of passion, and I would like to be part of it, and it's by which this group can actually make it more.
We have Dr. You have the floor.
Thank you.